Heart failure is a chronic condition characterized by the heart's inability to pump blood effectively. It occurs when the heart muscle becomes weakened or damaged, leading to a reduced ability to deliver oxygen and nutrients to the body's tissues. Common causes of heart failure include coronary artery disease, high blood pressure, and heart valve problems. When the heart fails to pump efficiently, fluid can accumulate in the lungs and other parts of the body, causing symptoms such as shortness of breath, fatigue, and swelling in the legs and ankles. Left untreated, heart failure can significantly impact a person's quality of life and increase the risk of hospitalizations and mortality. To manage heart failure, various treatment options are available, including lifestyle modifications, medications, and in severe cases, surgeries such as heart transplantation. One medication that has shown remarkable efficacy in heart failure treatment is Carvedilol. Carvedilol's mechanism of action in heart failure. Carvedilol belongs to a class of medications known as beta blockers. These medications work by blocking the effects of adrenaline on the heart. By doing so, they reduce the heart rate and decrease the sensitivity of the heart to adrenaline, which can be harmful in heart failure. In addition to its beta-blocking properties, Carvedilol also possesses alpha-blocking activity. This means that it blocks certain alpha-adrenergic receptors, further contributing to its antihypertensive actions. By blocking these receptors, Carvedilol helps to relax and widen the blood vessels, reducing blood pressure. The combination of beta and alpha blocking properties makes Carvedilol unique among beta blockers. It allows the medication to target multiple pathways involved in heart failure, leading to improved symptoms and better overall heart function. Benefits of Carvedilol in heart failure treatment. Numerous studies have demonstrated the benefits of Carvedilol in the management of heart failure. One landmark trial, known as the Carvedilol Prospective Randomized Cumulative Survival (Copernicus) trial, showed that Carvedilol significantly reduced the risk of death and hospitalizations in patients with severe heart failure. Carvedilol has also been shown to improve symptoms associated with heart failure. It can reduce shortness of breath, decrease fatigue, and improve exercise tolerance. These improvements in symptoms translate to a better quality of life for patients living with heart failure. Furthermore, Carvedilol has been found to have a favorable impact on long-term outcomes in heart failure. It can prolong survival and reduce the risk of disease progression. This makes it a valuable addition to the treatment regimen for patients with heart failure. Carvedilol for hypertension. In addition to its use in heart failure, Carvedilol is also commonly prescribed for hypertension, or high blood pressure. Hypertension is a common condition that affects millions of people worldwide and is a major risk factor for heart disease, stroke, and kidney problems. Carvedilol's mechanism of action in hypertension treatment is similar to its effects in heart failure. By blocking beta-adrenergic receptors, it reduces heart rate and decreases the force of contraction of the heart, leading to a decrease in blood pressure. Additionally, its alpha-blocking properties contribute to the antihypertensive effects by relaxing the blood vessels, further reducing blood pressure. Several clinical trials have demonstrated the efficacy of Carvedilol in lowering blood pressure. It has been found to be particularly effective in patients with high blood pressure and concomitant heart failure. By addressing both conditions simultaneously, Carvedilol provides a comprehensive approach to managing hypertension in this patient population. How Carvedilol works in hypertension treatment. Carvedilol's unique mechanism of action sets it apart from other beta blockers commonly used in hypertension treatment. While traditional beta blockers primarily target the beta-adrenergic receptors, Carvedilol's alpha-blocking activity allows it to have additional vasodilatory effects. These vasodilatory effects are particularly beneficial in hypertensive patients with heart failure, as they help to reduce the workload on the heart and improve overall cardiac function. By widening the blood vessels, Carvedilol allows for better blood flow, reducing the strain on the heart and lowering blood pressure. Furthermore, Carvedilol has been found to have antioxidant and anti-inflammatory properties, which may contribute to its overall cardiovascular benefits. These additional mechanisms of action make Carvedilol a valuable medication for managing both hypertension and heart failure. Side effects and precautions of Carvedilol. Like any medication, Carvedilol is not without its side effects and precautions. Common side effects of Carvedilol include dizziness, fatigue, and low blood pressure. Some patients may also experience fluid retention, which can lead to swelling in the legs and ankles. Carvedilol may also cause a slowing of the heart rate, especially in patients with pre-existing bradycardia or heart block. Therefore, caution should be exercised when prescribing carvedilol to patients with these conditions. Regular monitoring of heart rate and blood pressure is recommended to ensure optimal dosing and minimize the risk of adverse effects. Additionally, carvedilol should not be abruptly discontinued, as this can lead to worsening of symptoms and rebound hypertension. If carvedilol needs to be discontinued, it should be done gradually under the supervision of a healthcare professional. Dosage and administration of carvedilol. The dosage of carvedilol may vary depending on the indication and individual patient factors. In heart failure, the initial dose is typically low and gradually increased over time. This allows the body to adjust to the medication and minimizes the risk of side effects. The target dose for heart failure is usually higher than that used for hypertension. For hypertension, the starting dose is typically higher, and adjustments are made based on the patient's response. Close monitoring of blood pressure is necessary to ensure that the optimal dose is achieved. Carvedilol is usually taken orally, with or without food. It is important to follow the prescribed dosage and administration instructions provided by the healthcare professional. Missing doses or taking more than the prescribed amount can lead to suboptimal control of the condition or an increased risk of side effects. Carvedilol versus other beta blockers for heart failure and hypertension. While carvedilol has demonstrated significant efficacy in heart failure and hypertension, there are other beta blockers available for the treatment of these conditions. Some commonly used beta blockers include metoprolol, bisoprolol, and nebivolol. Each beta blocker has its unique characteristics and may be more suitable for certain patients or specific clinical scenarios. For example, bisoprolol is known for its cardioselectivity, meaning it primarily targets the beta-1 receptors in the heart, making it a preferred choice for patients with underlying lung disease. Nebivolol, on the other hand, has additional vasodilatory properties, similar to carvedilol. It is often used in patients with hypertension and heart failure due to its dual mechanism of action. The choice of beta blocker in heart failure and hypertension should be individualized based on the patient's specific needs, comorbidities, and medication tolerability. Consulting with a healthcare professional will help determine the most appropriate beta blocker for each patient. Conclusion. Carvedilol, with its unique mechanism of action, holds a prominent place in the treatment of heart failure and hypertension. Its ability to block beta-adrenergic receptors and alpha-adrenergic receptors makes it a valuable medication for managing these conditions. In heart failure, carvedilol has been shown to improve symptoms, reduce hospitalizations, and prolong survival. In hypertension, it effectively lowers blood pressure and improves overall cardiovascular function. The additional vasodilatory effects of carvedilol make it particularly beneficial in patients with concomitant heart failure and hypertension. While other beta blockers are available for the treatment of these conditions, carvedilol's multiple pathways of action set it apart. Its unique combination of beta and alpha blocking properties makes it a preferred choice for many healthcare professionals. As with any medication, carvedilol is not without its side effects and precautions. Regular monitoring and close follow-up with a healthcare professional are essential to ensure optimal dosing and minimize the risk of adverse effects. Overall, carvedilol's mechanism of action and clinical benefits make it a valuable agent in the management of heart failure and hypertension. Its ability to improve symptoms, reduce hospitalizations, and prolong survival has a significant impact on patient outcomes and quality of life.